And now, may I please call to the lower podium the President of the American Osteopathic Association, Dr. Ernest R. Gelb. Have no fear, Mr. Speaker, I'm not going to kiss you. Good morning again. Has anything changed since I was last here? Well, yeah, it has, because we've introduced Kathleen. Come on, help me here. Yeah, there we go. Thank you. So, Speaker Morrison, Vice Speaker Broder, Secretary Creason, House of Delegates, guests, diplomats, welcome. It's been a year since I stood here to deliver my inaugural address as your 126th President of the American Osteopathic Association. And what a boring year it's been. Nothing going on, not a thing, sit in my chair, drinking coffee, doing nothing, waiting for the damn phone to ring. Yeah, I don't think so. We've been down the road with Ms. Creason. I'm not sure if you're ever going to get sick of hearing that, are you? Okay. So we can redo this whole thing, but we have a new CEO. Which gives us pause to celebrate. And a question, show of hands. From last year's meeting, how many delegates and alternates went home with COVID? Yeah, sorry about that. So we didn't bring it back? No COVID? Another reason to celebrate. So there we go. So each year, following the House, your AOA leadership meets to develop a blueprint for the ensuing year, to determine how we can best work together to advance our profession, to predict where we can make the largest impact and how we can best serve our osteopathic community of DOs, osteopathic medical students, as well as our patients. First, simply stated, we need to cultivate the youth of our profession, the students, residents, and those physicians new to practice need mentorship to collaborate, advocate, and communicate on the behalf of our profession and all DOs. They, as do we, need to continue to honor our profession, and they need us to continue to stay engaged and to help them succeed. During my travels over the past year, I've had discussions with student leadership at many comms, as well as state and specialty meetings. The discussions had a common denominator: love for the osteopathic profession, my profession. They are filled with great ideas and are motivated as well. They are all well-versed and articulate on the state as well as the national stage. I have spent time with individual students as well as in groups both large and small. It was absolutely refreshing to sit and discuss various issues as well as life plans. What do you want to do when you grow up? That was my favorite question. It's a simple question, so many different answers. However, my own answer might surprise most of you, and that's stay in mine, not yours. You're not going to see it. We talked about the match. We talked about boards. We talked about GME. We talked about stress, both financial as well as academic. We engaged in meaningful and productive ways. We discussed professional parity. We partnered on student initiatives and advocacy, including equitable institution fees for student rotations, added student positions to the DO editorial board, AOA SOMA Collaborative Student Membership Campaign, OMED Student Track, as well as a student parity town hall. In addition to ensuring our graduates have training opportunities, we continue to emphasize the value of training programs with osteopathic recognition, the ACGME designation for programs that offer osteopathically distinct training. By furthering osteopathically distinct training of DOs, osteopathic recognition is a differentiator that sets programs apart in a highly competitive market. We also launched a new distinction last year to recognize all residents and fellows who complete an ACGME program with osteopathic recognition. The AOA works with directors of osteopathic education and programs with osteopathic recognition to send distinction of advanced osteopathic training certificates to all residents and fellows who complete the additional osteopathic recognition requirements. The second focus is on what I will call the mature physician, and that's a lot of you, but not me. I'm just telling you. This is member engagement and enhancing membership value, benefits, and services. We all know the demographics of the sub-45 group with a touch of gray and of gender and diversity. Their concerns are significant and include big issues like a shortage of GME, CME, board certification, as well as osteopathic continuing certification and maintenance of licensure. Significant stress is aimed at scope of practice issues which surround all of us. Known as scope creep, our national and grassroots efforts have had many wins in this arena. We have a wonderful staff in Washington, D.C. that engages and fights for legislation on behalf of our members. Let me repeat that. Fights for our members. When a physician approaches me with an issue, I'm always glad to hear from them. But the first question I feel I must ask is, are you a member? If they are, then we talk and problem solve. If not, I share that the AOA is a national membership organization that goes to bat for its members and will fight shoulder to shoulder for you and with you. And to be sure to become a member today. Membership remains an issue with not only the AOA, but with most professional organizations. We have made progress in our member engagement and enhancement efforts, including a full membership database transition, longitudinal member satisfaction survey, bolstering COCA staff, structure and consolidating oversight of certifying board services and GME. We also introduced a new OMT designation and launched the AOA's very first Leadership Academy to develop physician leaders. This is developed and run by Priya Garg, who's our own Chief Diversity Officer. We will continue working towards enhancing the AOA's unique value proposition. Membership engagement efforts occur on many fronts, including collaboration with organizations like the Coalition for Physician Accountability, the NBOME, ACOM, the G6 Fly-In, as well as the Bureau of Federal Health Programs, and many others. The third area of focus was to expand the depth and breadth of our osteopathic profession. We are forging new relationships and rekindling old ones. As the professional home for the nation's growing workforce of osteopathic physicians, the AOA regularly partners with internal as well as external stakeholders across healthcare industry, including federal agencies, national organizations, corporations, and of course, our affiliate partners to build and implement health initiatives at the national, state, and local levels. Last October, I was invited to participate in a secret squirrel meeting, is what I like to tell it, at the White House. I got this email on my computer with the White House logo, and I'm looking at this thing saying, yep, sure, this is real. Ernie's going to Washington, So what do? I pick up the phone and I call John Michael Villarama, and I say, John Michael, what the hell is this? He called me back in about 20 minutes and said, yep, it's the genuine article. And we had about 3 days to logistically put the trip together. Bottom line, it was 12 houses of medicine to discuss the COVID response that our federal government tried to do. They weren't real happy with me because they wouldn't really comment much on the politicization of COVID and the weaponization of the vaccine, and they were just annoyed with me. But I was invited back for a Zoom meeting. So the Surgeon General and the new COVID czar with 2 staff members attended. Clear communication was an integral part of the message, and it worked out well. I attended the AMA Interim House of Delegates in November and had an open discussion with their Board of Trustees, the first DO to present to their board by way of invite. I also attended the AMA State Advocacy Summit in Tucson, Arizona. We reciprocated with an invite to the AMA for a representative at mid-year, and they accepted. The AOA has also been collaborating with stakeholder organizations, including the NBOME and others to address discrimination against DO students and trainees. While there are various initiatives for equity in rotations and residencies at diverse levels of our organization, I am proud to report that some of our specialty organizations released statements on behalf of the osteopathic community. New communications, new friendships established, uncharted waters, and 2 firsts for DOs. Again, clear and direct communication. One of the most impactful ways the AOA works to ensure a successful future for the osteopathic profession is through political advocacy on behalf of DOs and osteopathic medical students. AOA members play a critically important role in advancing the success of the AOA's advocacy efforts. In 2023, at the state level, the AOA's public policy team collaborated with osteopathic affiliate organizations to send 21 letters on 15 different issues and 9 state-specific grassroots alerts to state lawmakers. In addition, more than 880 individuals from 7 states sent almost 2,000 messages to state legislatures. The AOA also initiated more than 20 online grassroots opportunities, and 2,600 members of the osteopathic community got involved by sending nearly 5,000 messages to federal and state lawmakers. Grassroots advocacy contributed to important policy wins on behalf of osteopathic communities in states and at the federal level. Through our grassroots advocacy efforts and with state affiliates and specialty colleges, the AOA achieved several notable wins on behalf of the profession, including the historic $1.44 billion, that's a B, billion-dollar 6-year reauthorization of the Teaching Health Center Graduate Medical Education Program, which invests the money in the training of physicians in community settings and helps to attract physicians in rural and medically underserved areas. That's a big win. And this was achieved in collaboration with the Maine Osteopathic Association and other partner organizations. Prevention of cumulative 8.5% Medicare cuts to Medicare payment rates were scheduled to take effect this year. We successfully enacted legislation that includes funding for the distribution of 200 additional Medicare-funded graduate medical education residency programs per year over the next 5 years. We nominated and secured the appointment of Jenny Kwan, DO, to the Centers for Disease Control and Prevention's Healthcare Infection Control Practices Advisory Committee, which provides advice and guidance to the Department of Health and Human Services and CDC on infection control practices, and I would love to see that on her business card. Wow. Finalization of CMS rules to improve prior authorization in Medicare Advantage, including changes that align PA requirements with Medicare fee-for-service coverage rules. A 2-year extension of numerous Medicare telehealth services that were temporarily available during the COVID-19 public health emergency. Unanimous adoption of a Senate resolution designating the week of April 17th to the 23rd of 2023 as National Osteopathic Medicine Week. In May, I was fortunate to participate as a member of the Group of 6 in a fly-in advocacy day in Washington, D.C. Representing more than 600,000 frontline physicians and medical students, the fly-in enabled us to advocate on behalf of DOs and osteopathic medical students in face-to-face meetings with influential House and Senate leadership, including House Minority Leader Hakeem Jeffries, House Ways and Means Committee, Senate Finance Committee, Senate Majority Leader Chuck Schumer, Senate Health, Education, Labor, and Pension Committee, State Minority Leader Mitch McConnell, and Speaker of the House Kevin McCarthy. Topics discussed included the 3 key advocacy issues for DO Day on the Hill, as well as other issues that impact the practice of medicine and patient care. So as you can see, I really didn't have a whole hell of a lot to do this year. It's been a year. It's been challenging. It's been rewarding. It's been scary and occasionally damn depressing, but overall jubilant and, of course, really busy. All of my work was made so much easier by our AOA staff, and they're scattered through the room, and these men and women have talked me off the ledge I don't know how many times. I have grown in ways that I will never imagined, and none of this would have been possible without the love of my life, my life's partner, Barbara. Thanks, babe. It's been unbelievable. The hospitality afforded us by our profession is immeasurable. Thank you very much. And again, a shout out to Pennsylvania for your continued support, even though you are an award-winning state. So thank you very much. And as I said last July, thank you for the honor of your selection, as well as the privilege of your time. Thank you very much for your time. I appreciate it.